Hello, I'm Dr. Rohini. Today I'm going to talk about the procedure diagnostic hysteroscopy. So basically what is done in this procedure is that we check the inside of the uterus to see if there is any abnormality and if any abnormality in the shape of the uterus or any abnormality in the lining. So what are the indications for which it is done? So one, it is done in case of patients who are bleeding heavily to find out the cause of bleeding, which can be due to a fibroid, which can be due to a polyp, and sometimes it may be also due to some abnormality in the lining of the uterus or due to cancer of the uterus. Next, it is also done in patients who are suffering from recurrent pregnancy losses to find out if there is any abnormal shape of the uterus like septum or if it's a septate uterus, that can be found out. And it's also done for evaluation of patients who are having recurrent implantation failures when they are undergoing infertility treatment. So now I'll talk about the procedure. First of all, it's a daycare procedure. It is a minor procedure. The patient is expected to come to the hospital on empty stomach, and then we would be giving sedation to the patient, and the patient will be put to sleep. So there will be no pain during the procedure. So during the procedure, we would be inserting a hysteroscope, that is basically a camera kind of instrument inside the uterus, and usually some fluid is injected into the uterus to distend the cavity of the uterus, and then the images that are taken are seen on the monitor attached to these instruments. During the procedure, we can see the shape of the uterus, and also we can see the ostia, that is the opening of the fallopian tube. And in case if we find any abnormality, at the same time we can address those abnormality and convert this procedure into a operative procedure. So in case if we see a cavity distorting fibroid or a polyp or any abnormal tissue which we feel may be cancerous, those tissues can be removed at the same time during the procedure. And after the procedure, the recovery is usually very smooth for the patient. The patient can start taking food after 2 hours after the procedure, and then we discharge on the same day. And you can carry on with day-to-day activities after the next day. There is no bed rest required more than 24 hours for this procedure. And there are some minor complications that can happen. The patient may experience some pain, abdominal cramps, bleeding, and there are some serious complications like there is chances of infection. There may be also chances of injury to the uterus, but these complications are quite rare, may be seen in 1 in thousands of women. So this is what you can anticipate when you are undergoing diagnostic hysteroscopy. So I hope I was clear in explaining this topic. Thank you.